And joining us now is Dr. Jeffrey Reynolds. He's with the Mineola-based Family and Children's Association. And welcome to the show, Doctor.
Thanks for having me on.
Unfortunately, we keep talking about this. We've been talking about this for years.
We do.
And it just seems to get worse. I understand, it's really drawn the attention of the governor. Governor Cuomo came to visit you this week. Tell us what was discussed there and what's going to be coming on the way from New York.
Well, we were very excited to welcome the governor to our brand new recovery center out in Suffolk County, just off the Long Island Expressway in Hauppauge. The governor was there signing some budget bills, which will add a significant amount of money, $23 million to be exact, for Long Island to help fight the opioid and heroin crisis, and there's money allocated statewide. And so this is a huge increase in spending. Spending in New York State has about doubled since 2011, so we're excited about that because I hope there's a time when I can come and report to you the numbers of fatalities are actually dropping rather than continuing to escalate.
And we'll talk about the phenomenon that's driving this, because there's a lot of factors to it. You saw the profile of a person who runs to a church to get a few bucks in order to feed their habit. And we'll talk about what's driving this. But what will that money be spent for, first of all, the $23 million?
Specifically, when we look at every step along the way, we need to be doing more. So when we think about the beginning of the process, we're talking about prevention, school-based prevention programs, family-based workshops, things like that, to prevent people from even starting drug use in the first place. Secondly, we've got to make sure that treatment on demand becomes a reality. There are currently waiting lists at inpatient and outpatient facilities across New York State where folks are begging for treatment, saying, I'm ready to get help, I understand I have a problem, and they can't get in. And then third, supporting those people who do complete treatment to make sure they're on a path to recovery that not only gets them to stop using drugs, but helps them to reclaim their lives. And so at every step along the way, we got to be doing more.
Because you described on a previous appearance on this show here that people will often go to the hospital, they'll be revived perhaps for a couple of days. They'll get treatment, and then they go back out on the street, and they're back using shortly thereafter, right? Yeah,
there have been thousands of people who have been lucky enough to be revived with naloxone. It's a wonder drug. It brings you back from the brinks of death in the midst of an overdose.
The Narcan is more popularly known as, but it's called naloxone.
Naloxone. Yeah. But the thing is, it gives you the ability to breathe again, but it doesn't give you your life back. So unless you're linked up with treatment and care, you're probably going to succumb to an overdose at some point along the way. It would be equivalent to talking about CPR, right? So CPR won't cure heart disease any more than Narcan or naloxone cures addiction. You've got to get the treatment after the fact. So we want to make sure that those folks who are revived are given their lives back and linked up with treatment right then and there.
Is this $23 million enough?
It's hard to say how much enough would be. When I look at what's going on, when I look at the huge number of fatalities in our region, and when I look at the daily funerals and the daily Shiva calls and just the wreckage that's occurring in our community, it'd be hard to put a number on what exactly is enough. I do think we're beginning to turn a corner and beginning to treat this as the public health emergency that it is. This is like any other emergency. The longer you wait to deal with it, the worse it gets. And right now, we're paying the price. In your opening shots, there was a discussion of the Medford pharmacy murders back in 2011. A lot has happened since then, and the problem's gotten worse, and the problem was around probably 6 years before that. And so now we're in a position of, we gave heroin and opioids a 10-year running head start. We better do a lot to catch up.
Well, and it's a convoluted path, too, because a lot of it is traced back to the opioids that were routinely prescribed by the millions and hundreds of millions of pills that were put out there, and then people started abusing it, and some of the providers are abused it. Some of them are behind bars for doing that. And now you even hear of lawsuits that are going to be brought against the manufacturers. What has changed in the world of distributing these opioids? What purpose are they being used for now? Are they being basically taken away from pain medication, or what is the practice now?
There's been a dramatic shift. Prior to 2011, there really was a free flow of opioids into our community. People were getting root canals and leaving with giant vials of OxyContin and Vicodin. That's changed now. I think providers are more educated. I think patients are more educated. Obviously, the state has taken steps to restrict the flow of opioids. I don't think, and we always want to guard against this, I don't think it's impacted the average pain patient who has legitimate physical pain that needs those medications. But I would say none of these medications were originally designed for chronic pain. They were designed for acute pain. And so there is a discussion happening about, can we come up with some meaningful alternatives for folks who are suffering from chronic pain. If it's not opioids, then what? It can't be nothing. We can't allow people to walk around in pain.
Still have that pain.
Right.
Now, and then there's this fentanyl, carfentanil. First we were worried about fentanyl, then we hear carfentanil, and we're like, where's this stuff even coming from? Who's bringing this into our country?
You know, we're seeing a lot of this stuff coming from China. We're seeing some of it produced domestically. If you recall, about 3 years ago, you and I sat here and talked a little bit about the potential arrival of fentanyl here on Long Island.
And now it's here.
And now it outpaces heroin deaths. And I worry about carfentanil. So carfentanil is exponentially more potent than fentanyl. Somebody asked me recently, how will you know if it's here? We'll know it's here because you're going to see an immediate upswing in fatalities, immediately.
So what should family members look for, the signs that someone has gone down this path?
You know, I think most family members know intuitively when something's going on, and they tiptoe around the question. I would say, if you see something, say something. We've heard that before. That applies to addiction as well. So if you see a change in somebody's mood, a change in who they're hanging out with, a change in their spending patterns, a change in their finances, if they don't look right to you, have the conversation, and don't only have it once. Make sure there's an ongoing dialogue with that person.
Well, Dr. Jeffrey Reynolds with the Family and Children's Association now have a new treatment center in Hop Hog. We want to thank you for the update on this critical issue and your efforts in it.
Thank you.
Thank you very much.